Hi, my name is Ray James. I'm an ambassador here at KC. I'm here with Cindy Hoffman, and she's going to talk to us a little bit about DMS. But first, just tell everyone how long you've been at KC and sort of what you do here.
Well, I'm the Diagnostic Medical Sonography Program Coordinator here at KC, and I just received my 20th year pin. So we had our 20th annual pinning ceremony last October, so we've started our 21st year with the ultrasound program here at Kaskaskia College.
What sort of skills do you need to be successful if someone wants to go into a career in sonography?
I usually tell any prospective student that does call and ask some questions about that. An independent thinker, very independent, and have a lot of creativity within themselves because they're going to be looking at images that they have to identify the anatomy and have a good visual mindset about what they're looking at.
What kind of schooling does it require?
Well, there are different ways to go about becoming a sonographer, but here at Kaskaskia College, we look at two of the pathways that the American Registry of Diagnostic Medical Sonography puts out there, and we follow the 2-year allied health degree or having a bachelor's degree. So, for example, my route was radiology first because it's a great smooth pathway into sonography. So it's a higher level than your 2-year allied health degree, but we do accept any 2-year allied health degree program, radiology being one of them, physical therapy, respiratory therapy, nursing. If they do a bachelor degree route, meaning that they went in and got their bachelor in science, all right, and they wanted to come back and do some sort of skill set, we accept those students, but they do have to go through and complete the CNA courses because they don't have the patient care aspect.
Okay, so they have quite a few options
Yes.
on how they want to do that. So is there anything that students learn in your course that you think would be unexpected or something that's surprising that you do learn when you go through the program?
That's a great question. I think anything in the medical field, there's always those surprises that you really don't realize that you have to do. We do the general sonography, so we look at the abdominal organs. We do OBGYN, so we look at the babies and we look at the female organs, and then we do the small parts consisting of the thyroid, the testicle, the breast, prostate, those aspects.
Okay, can you talk a little bit about just some of the hands-on things you do in class or some of your labs?
Yes, we do physics. That's our didactic aspect and our anatomy and physiology. And then we have the hands-on lab components where we take the coursework from the classroom and apply it into our scan lab. So we have 4 pieces of equipment in our scan lab setting. We have several mannequins. We have OB-specific mannequins, so they actually get to scan in a normal controlled environment doing OB ultrasound, which is always a challenge. But when you go in the real world, the babies, they don't lay still. So it's a nice way to have a scan lab, but then in reality, it's not exactly how it would be in a hospital setting.
And of all your years of experience, what has been some of the roughest things that you go through?
There's just so many challenges. Each person has their own backgrounds that they're bringing in to the classroom and stuff, so you're dealing with a lot of just diverse situations. So I can't pinpoint exactly one, but there seems to always be something that the students, just the amount of studying, I think that they don't realize how much it does take to put the time in to learn how to do this well, to be able to be a very good sonographer.
All right, and it does take a lot of practice outside of school. You can't just try to smart through or anything. They have to really study and know the material.
They do. There's a lot of expectations with the classroom part of it.
What's the most valuable lesson you've learned from this job?
So one of the most valuable lessons I learned from this is that you can't judge a book by its cover. So each student is bringing in their different backgrounds and they're very diverse individuals. And I can't take like past experiences that they've had and think that you can kind of know how they would be. Just for an example, we've had some past grads that didn't finish high school. They went on to get their GED. Then they went into the radiology program and they went into ultrasound. So even with those type of backgrounds, people may think, well, I didn't even finish high school, or I wasn't a real good student in high school, and that shouldn't set them up for anything, because you can do anything you put your mind to, and that's one of the most valuable lessons I learned, is that just give that person an opportunity and they can take it and just soar with that. So.
Okay, perfect. And then why should a student choose Kaskaskia College to pursue their education?
Well, why wouldn't you come to Kaskaskia College? We've got 20 years of experience here. We've got very much one-on-one settings. The clinical sites are outstanding. We go all the way to St. Louis. We go up north to Champaign, Decatur, Springfield, all the way south, Carbondale. We go all over into St. Louis, the metro area. So we have great clinical sites, and we're very affordable. We're one of the very few sonography programs in the area, and we're here to help you. We want to see you be successful, and that's one of the biggest things, is we care to help you get through what you want to accomplish.
All right, well, thank you so much.
Nice to talk to you.